Dr. Matthew Devine, the medical director at Highland Family Medicine, is back with us. Doctor, good morning.
Good morning, Mark. How are you?
Great. So COVID vaccinations, the hot topic. President Biden says he wants 100 million vaccinations in the first 100 days of his administration. Can it be done, and how do we get there?
Yeah, that's a great question. I think we can get there. I think the aggressiveness of this has really prompted us to kind of speed up and move along with our production. You know, the Biden's group, the day after their election, started working on a 200-page document that they recently released that has all no short of 7 aims of areas to help us in this fight against coronavirus.
Let's get into these 7 aims, these 7 goals that they're focusing on.
Right. So I think the biggest one to start out with is just to restore trust. You know, the U.S. citizens and people have wondered what to do next. So that's there. Making a safe vaccine available to really mitigate any other areas of difficulty. So making sure we have enough of that to expand our emergency relief, to really safely reopen our schools and businesses and to kind of start travel again, and really to promote the vaccine to those at the highest risk, and to really help leverage our relationships with other world leaders in which we need to continue to work on a world strategy, not just a U.S. strategy.
All right, let's dive in on one of these key goals here, this idea of mounting a safe, effective, and comprehensive vaccine campaign. How do we do this, Doctor? Right.
So we've this. Keep in mind that the vaccine has only been approved now for a little over a month. We've been working on different sectors, our healthcare workers into our essential workers, and now those that are over 65. And so really this entails ramping up vaccine clinics across the country. And so getting to 1 million doses per day is actually things that we've already almost reached in the recent days. But obviously we have to do that every single day over 100 days. And so I think getting there is going to be a full-fledged effort. And of course, it does depend on the supply of the vaccine that we have.
Of course, vaccination is just one aspect to bringing the number of COVID cases down, right?
Yes. I mean, I think there is so much there in this document. It really does encompass all of the things that we have. To name a few, that focusing to reach those hard to find or high-risk populations, really getting good public education out there about the safety of the vaccine itself. I think there's still a lot out there about concerns about first dose even versus second dose side effects. I'm living an example that it's okay. You're not going to have any significant problems. Those problems are really less than 2%, which is a very, very small number. And even those 2% have a very, very small side effect to the medication or vaccine.
Let's leave it there. Such an important conversation. It continues today and will so into the future as well. Doctor, thank you.
Thank you, Mark, for having me.
If you missed any of it, we'll be sharing it online as well at rochesterfirst.com.